I work in Merakoi as an engagement manager, which in simpler words means that I make sure the project moves well. For example, I coordinate the project behind the scenes, so I work on timelines, deliverables, client communications, and internal alignments. And so I'm basically the person who makes sure that the project keep on tracks and nothing drops. But at the same time, I'm also a moderator in the patient sessions. And this is where I think I can influence the most the patient experience. Because for me, first of all, it's an honor to hear and learn from them. And at the same time, thanks to their insights, I can really influence the project because their insights will be the driver of our project. The patient experts, they just bring the lived expertise, and is not the just, is the unique knowledge, experience, expertise that we cannot learn from the books. And of course, this improves every project because the patients are contributing to them and shaping the insights. And this is the best that can happen in a project. So how we can make it easier for them is to create really a safe and trusted environment where we are able to listen to their inputs, but also make them feel welcomed in saying, their insights and their experience, and also design the sessions that will allow them not just to validate a concept, but to co-create something, to improve something. And the best way to close everything, to close this loop, would be that we are able to show them how their inputs influenced and make changes into the project. Well, in my experience, sometimes we bring patients, experts, too late into the project, especially when we speak about research, and therefore we limit their influence. And sometimes what I heard is that they are their feeling is that they are kind of a sense check instead than equal partners, and they just need and want to be seated at the table as equal contributors. So the way we can fix it is that we can involve them earlier at the design stage, also design projects that allow space for listening to them, to their stories, but also really create space for them to share their knowledge, because at the end they are experts in their field, and also be able to educate the teams to listen to them as, a learning point, not just as we want your answers. So really they need to be felt as contributors and partners with a space and time in it. A moment in which the patient changed the direction of the work was when we were looking for understanding if the patients can live without thinking about the disease. And what I heard is that, of course, you can free up a little bit of your mind, but you cannot forget what happened to your body, especially if you are older and you bring with you the signs of the disease. So, of course, this was really a learning point also for the project, because it means that we need to also take care of the emotional journey of patients and not just thinking about, the treatment, the medication as a changer. Because anyway, what they lived, we remain with them. So we can improve, the quality of life. And of course, this will be amazing. But we need to think about the patient as a whole, bringing with them their past experience and mix it with a future and potentially better one. One of the sentence that I use the most is, okay, let me check and I will come back to you. And actually, what does it mean is that I don't know exactly at that moment the answer to that question, or potentially is something that we didn't agree before. So I don't want to say yes or no on the spot, but I want to take time potentially to align internally or to check with other partners and then have time to assess it. So it's kind of creating some time for thinking about it without saying a sharp no, yes, that can sound, hard at that moment.
Tap that button.